throughout the nation, across state lines, down main streets and gravel roads. The heartbeat of rural America lives and thrives. But when it comes to access to health care, the land of free roaming and endless horizons meets one of its greatest challenges.
My first job was in rural areas of North Carolina, patients that had certain clinical conditions that couldn't be met by local healthcare facilities. And so I thought, hey, why aren't we using telemedicine? Telemedicine has been around since 1970. We have more medical devices and technology to connect patients and physicians than we ever have before. But I think the vast majority of it is the fact that patients really don't feel connected to their physicians when they use technology. And so I kind of set out on my own personal journey to try to figure out how we not only bring telemedicine to underserved communities, but how do we do it in a way that's much more personal?
With the Innovator Health telemedicine platform, health systems can export their services to their surrounding community hospitals. This allows patients to stay local, unburdened by the hours and miles of travel to the nearest specialist, all the while receiving comprehensive and personal care.
Good morning, Donna. I'm Dr. Craig, an internal medicine doctor. I understand you're feeling a bit under the weather today.
Right. I've been sick for the last couple of weeks. It just, instead of getting better, it seems to be getting worse.
Okay, well, let's see what we can do today to make you feel better and get you out of here doing a little bit better than when you came in, okay?
Okay.
The Innovator Health platform provides a life-size form and facilitates direct eye contact between the patient and physician, building that necessary trust and rapport. The Innovator Health platform is so immersive, the technology seems to disappear once the exam begins.
I don't want anybody to see the technology that sits between the patient and the physician. So what I've tried to do is make the technology as simple as possible so that when the physician sits down, it's as natural as sitting in front of a patient. And I find I can do about 90% of my typical internal medicine practice through our telemedicine systems.
The technology available through telemedicine can prove even more comprehensive than the typical in-room exam. Digital stethoscopes provide clearer audio, recording, and sharing. And digital cameras can allow doctors to enhance images for greater insight, annotate and compare before and after states. All of this can be done without the limitation of distance using a HIPAA-compliant low-bandwidth codec that runs with crystal clear signal even on a 4G network.
So palpation is really the difference between what a physician does in person and what a physician does through technology. And I think as a physician, that part's important to me, it's important to the patient, it's important to diagnose, and it's important to be able to sustain the program. And having a well-trained nurse in the room that can help facilitate the knee examination or the palpation of the abdomen are certain parts of what we help health systems to do so that they get the greatest experience from the telemedicine exam and the physicians are the most comfortable with the outcomes that they're finding.
Just as the technology helps build a relationship between patient and physician, Innovator Health as a company builds a strong relationship with health systems.
We bring the relationship between us and our customers so they can build strong relationships between themselves and their customers. Our relationship really begins when we help them to implement and use the technology successfully. We want to be there as a part of that. We want to help them to grow. When they have a particular healthcare need they want to service in a community and they're not sure how to go about it, we can help them build the ROI. When they're concerned about, okay, where do we go for billing and coding questions? Where do we go for compliance questions? We can help them with those things. But it's not about us just selling a piece of technology to a company. It's about how can we help them use the technology to be more effective, to be able to bring healthcare services in a way that they couldn't bring them in before, and how they get a strong return on their investment so that they can continue to grow those programs.
The heartbeat of rural America is strong, and it can be heard, seen, and felt from anywhere at any time. Welcome to Innovator Health, telemedicine brought to life.